You know, obviously that's the usage back depending on the usage. One thing St. Augustine is advantage. I think it's very important to a energy consumption. Shorter distances, you can sort of frequent a little bit, because clearly if charge, anything like that. Well, we were way ahead of you guys for the certain stuff. And I had two for us, from New York. Is that right? Okay. I got to go. 65 is all I can get, right? You got 65, I just might make it. Oh, okay, yeah. Well, then we will definitely be, you know, energy is energy, and you can't sort of make it better unless we have pushing them that we can't, just sort of, you can't defeat physics. Well, I think unless, you know.
Is that going live or is it live?
It's live.
Oh, nice. So we had some torrential downpour here in Santee, and we've been very fortunate. Clark's in here has let us use their facilities. We have the whole Carolina Urology and Lexington Medical Center crew here. Everyone say hello.
Hello. Hello.
Well, we're getting started here. Dr. Willard. Dr. Willard, how you doing?
I'm great.
Are you dry?
I'm dry.
Let's look at your hair here. It looks pretty dry.
I don't have any hair.
But if it was still raining, we have our official draft for men's health umbrellas with us.
There's one here on the table.
Yes, please.
Do you guys want to take
All
a
right,
seat?
so, oh yeah, let's go sit, Dr. Willard. Yeah. Is your cell phone? Oh, it's my cell phone. Yeah. So, Dr. Willard, we just to give you an update and the rest of our team an update, we have had a crazy marathon run. We definitely have so far underestimated for weather, and underestimated for setup time. And what's happened is we have 6 or 7 Teslas following us. So the supercharging stations, the more cars we have, then obviously the superpower charge isn't always super powered. But we're about 50 minutes behind, but it's okay. You know, that's how life is sometimes. So Dr. Willard today is actually, right before we were coming, we were talking about PSA screening, and we had a listener call in and actually ask us a question. And maybe you can go over this question too, but her father had colon cancer, and she was wondering, because her father had colon cancer at 61, when should they get PSA screening for prostate cancer? But before we get into answering that question, we're going to let Dr. Willard actually talk about PSA screening, what it is, and how it's important for prostate cancer health. Dr. Willard.
Yeah, I think I'll be able to answer that on the one of the slides that I have on the top, so it'll be perfect.
Okay. Do you have your slides here?
I'm going to load it up on the flash drive.
Oh, here. Do you want to use your computer?
Is that the one we're using?
Yeah, our TV screens are outside because of the rain, so we can load it over here.
Try to load it up.
And then when this talk actually gets is going to be on YouTube now, but when we edit it, we can add your slides in so that people can see it. And I'm so sorry. The weather kind of made us do some crazy things. Thank you to the Clarks Inn here in Santee for housing us during our drive here and our stop here while we charge. Which one is it?
It's the internal PSA talk document. There we go. Good. So we're going to hold it and watch this?
Yeah, we're going to do this, and then when we edit your film, we'll make it larger.
Okay. All right. So this is a fairly quick talk. It's entitled PSA, What is it, what it does, and what to make of it. I put this together for the drive for Men's Health, obviously. Next slide. This one. All right, so technical difficulty. And there we go. Okay, so we don't want this to be the impression for patients that we see. It says, "Hello, I'm Dr. Grossfinger. I'll be your urologist." We don't want that to be the case for guys not coming to get screened. We certainly don't want that to be the impression that patients get for whenever we're examining them. Next slide. But we do want them to come in and get screened. So PSA, what is it? So it's PSA stands for specific, and it's had many names over the years in its development, but it is a protein produced by the prostate gland, what's called a serine protease in terms of the classification for proteins in the body. It acts as an enzyme. Next slide. And an enzyme is a catalyst, and what it does, it's produced for the ejaculate. It liquefies semen to allow sperm to freely swim, and it's actually believed to be important in dissolving cervical mucus. So basically, it performs a reproductive function. Next slide. So in terms of PSA screening, there's been a lot of debate recently as to when to screen, do we overscreen, do we cause harm by screening, and so forth. So there's been a joint recommendation regarding PSA screening and testing that just came out by the National Comprehensive Cancer Network, which is made up of the National Cancer Institute, the American Urologic Association, and the American Society of Urologic Oncology. And the goal is to maximize benefit by minimizing harm, as well as minimizing harm in overscreening patients. Next slide. Seems to be slow. There we go. Okay, so
it's a little lag. Sorry about that.
So I think this may answer the caller's question from earlier. So what are the new guidelines? Basically, when to test for PSA. So men that are 85 to 70 that are healthy should be tested. Guys over 70 years of age with a longer life expectancy should be tested. Guys that are between 45 and 49 with their initial PSA test, if the PSA is less than 0.7 nanograms per mil, retesting should be done at age 50. Between 45 and 49, if the PSA is greater than 0.7, or between age 50 and 59, if the PSA is greater than 0.9, they should be retested 1 to 2 years. All guys with PSAs over 1.
Yeah, there's a lag. Sorry.
There we go. All right, so all guys with a PSA over 1 should be retested every 1 to 2 years. Guys after age 70, testing really should be individualized. Like I said, if they have a 10-year life expectancy, certainly test them. And if they have morbid conditions or other illnesses that are significant, they probably shouldn't be tested. So indications for biopsy in that group should be carefully evaluated. We're not doing any harm. And then primary care doctors should certainly send patients for biopsy if the PSA is over 3. So in summary, for heaven's sake, honey, it's for your own damn good. This lady's dragging her husband in a cage to the urologist. Hopefully the guidelines we appropriately put in will get screened appropriately.
Well, thank you. Let's give Dr. Willard a round of applause. Dr. Willard, you mentioned some guidelines, and I remember there was a lot of recent news in the media about a year or two ago about PSA screening, and some people say we shouldn't even do it.
Right.
And there's a certain task force that say we should not be screening for PSA. So there's probably people out there right now watching that have read those and said, well, this guy's telling me I should get my PSA screened. How would you answer that? I mean, if you had a patient like that come to your office.
Yeah, I tell them that bear in mind that the task force, whenever they came out, they were actually those were actually made and distributed by primary care providers. There were really no specialists on that panel that actively treat prostate cancer on a daily basis. So it's probably true that we do or have been traditionally over-screening people. So hence the new guidelines that are out is an attempt to minimize screening and trying to target the appropriate population of people. So I would say definitely get screened because it is a disease process that can be fatal if not caught early.
Now, is there anything equivalent to PSA that we can also order, or is PSA kind of the only test that can help us with detection of prostate?
No, It's probably the initial test that's going to be ordered, but there are some post prostate exam tests that can be ordered, such as PCA3, which is a urine test that can be used as an adjunct to PSA to potentially help guide biopsy.
And then, do you advocate genetic testing? Okay.
Yeah, absolutely. I'm very involved with ordering a genetic test. Certain biopsy patients to help decide who to watch and who to treat.
Okay. Well, Dr. Willard, thank you so much for having this conversation with us at PSA screening. Now, before we leave, I'd like for you to tell our audience here and online, why it's important for men to take better care of themselves.
Well, guys traditionally are too macho and they don't go to the doctor until something's really wrong. And I think the reason I wanted to be a part of this, and then I'm excited that you guys asked me to be a part of this, is the message is preventative care is very important. And don't be macho. Get a yearly physical exam. Get your blood work done yearly. Get the appropriate screening done. And it's not just for conditions. It's more common stuff like diabetes, high blood pressure, high cholesterol. So that we can try to minimize cardiac events and diabetes-related events for sure.
Well, Dr. Willard, thank you very much. Before we leave, I want to again, we're still charging the car outside, but we're kind of using some space here at the Clark's Inn restaurant. We want to thank you for allowing us to come here as it's a torrential downpour outside. We want to thank Lexington Medical Center for also coming here and showing support for men's health. Carolina, where Dr. Willard is from, for coming here and supporting men's health with us. And I want to thank our audience for sticking with us through our webcast on the road. We've been having some issues. We've been getting some messages about issues with sound and quality of video, so we apologize for that. We're kind of just using personal hotspots, and the weather and the speed of the car are really affecting things, but it's our first time, and we're learning from our experience, so hopefully next year AT&T, Verizon, or someone will sponsor us. Yeah. Just throwing that out there, guys.
Yeah, please.
But thank you, Dr. Willard. Thank you, Santee, and we look forward to seeing you next year. We're going to be doing this every year.
Absolutely.
And next year we're going to go from here to New York, and then we're going to drive to the West Coast. You're going to come with us.
I want to. Please let me know.
Thank you. And we'll chime back in. We're going to kind of wrap up here. We'll check back in about 20-30 minutes on our live cast. Thank you guys for joining.
Awesome. You very much.
I can't control the weather, but it's great.
It's really, really cool.
Do a lot of
Yes.
Oh, yes, where's
Yeah. I thought it was